Okay, in an exclusive interview, the chief of the Cowin app, RS Sharma, has spoken to Mirror Now's Ayushman to give us crucial details of the vaccination rollout program, phase 2 of the vaccination rollout program, which begins on the 1st of March. Listen into what he has to say.
The government is now going to expand the vaccination program, but the most important aspect of COVID-19 vaccination is the Cowin app. And now we have the chairman of COVID Empowered Group, Dr. RS Sharma. Sir, thank you for taking our time. Sir, now the vaccination is being expanded. How swift is the role of Cowin app going to be? Can you please explain us on that?
See, the point is that in such a large country where we are going to have a massive vaccination program, ultimately let's think we are 1/6 of humanity. And if we are going to run this program, we cannot run it without the help of the technology. Because we have to figure out each person as to what vaccine he got, what time he got, which place he got, and he should get the same vaccination after 28 days. So all this can happen only with a technology backbone. And I think we have prepared for that in this next phase of the program.
So earlier the vaccination was only for the limited population. Now it is going to be expanded. How the Cowin app is ready for that, sir?
So essentially what will happen is that now the paradigm of vaccination has become citizen centric. It is based on the people coming forward to get themselves vaccinated, and for that purpose they will take an appointment from a center of their choice, and then they will go and they will get vaccinated. Besides the appointment, there will also be facility for walk-in vaccination, which means that people who have not got the appointment, if they go to a center and if there are vacancies available, they will be also vaccinated.
Sir, we have seen through the rollout of the vaccination first phase for the healthcare workers and the frontline workers, glitches being reported from some states. Why is it that the glitches have been centered in some states like Maharashtra, Karnataka? Have you held consultations with that? What is the way forward?
No, we have studied the problem in quite a detail. What had happened is that when the Honorable Prime Minister launched this program on 16th of January, last January, there were initial 2-3 days, there were glitches. And we were able to rectify the software glitches immediately thereafter. Now the reports which you are having are the reports where people or organizers of the program are having difficulty because of the defect in the data. So essentially, suppose you did not enter the first dose data into the system, then the system does not know that that the person is coming for a second dose. And people will say, no, this system is not generating second dose because it does not know that you got the first dose, because you did not inform the system. So essentially, these are data related problems, and that is why they are reported from different states, not from all states, because if it was a software problem, every state would have faced the same problem. Now that is not the case. So therefore, these are issues related to data. Sometimes people uploaded the data, duplicate data of, the same person's data was uploaded twice. And then, these kinds of things have happened. So in this model, which we are now is going to start from 1st of March, there will be no data entry at the back end. There will be data entry by the people concerned. And when people enter their own data, it is expected that they will enter the correct data. And we are asking only for minimal data, which is basically their name, their age, and their gender. That's all. And their mobile number, of course. So this is the kind of data which is coming, which is hopefully we will get, everybody will write correct data, and we will have no issues of data related issues.
Sir, for the identification, will Aadhaar card be mandatory? Will any of these documents like Aadhaar card, PAN card, voter ID card needs to be uploaded? How do we upload that data?
No. The point is that Aadhaar provides a digital identification, digital authentication. So for that, no paper is necessary. You need to have your Aadhaar number, and then you come to the center and you authenticate yourself with the mobile, with the biometrics or whatever way. So therefore, there is no paper necessary. However, for other documents like driving license, like passport, like photo ID card of election, they are not digitally verifiable online. Therefore, you need to bring those documents. Those documents will also be photocopied. Their scan will be taken, and your photo will also be taken. So basically, if you do an Aadhaar authentication, it is paperless. If you do other authentications, They will also be allowed, but they will not be paperless because that thing will be uploaded at the back end.
So one question on the for our viewers on updating the data, or rather registering themselves on Cowin. What would be the process, if you can simplify for us, sir?
No, this is basically Cowin registration. You can do by multiple means. One of them is Arogya Setu app. They will have an extension of registration for Cowin, registration and appointment. Other will be the website of the Cowin portal, which is cowin.gov.in. Third will be the common service centers, or Seva Kendra as they are called in various states, where you can go and get help of the person who is sitting there, the village level entrepreneur. So essentially there will be multiple means by which you will be able to register yourself. We will also be probably certifying more applications in the future who just comply with our APIs, and they will also be able to get registration.
Sir, given the vastness of this program right now, you have more than 10 crore people to be vaccinated in this age group. Is the government conducting the training programs also? Are you meeting the states? You are seeking suggestions and all?
Yes, we are continuously meeting these states. The NAGVAC is meeting these states. We have been, the Ministry of Health and Family Welfare is also meeting these states. Today itself, we are going to have a training program or a demonstration, demo of the software, etc. with these states. Just after this at 11 a.m. So we are continuously in touch with these states, and now that the private sector hospitals have also been involved in the vaccination program from 1st of March, we are also conducting training sessions with the private hospitals also.
Sir, a larger chunk of elderly population also resides in the villages and the rural areas.
Right.
How adaptive will this app be, or the registration module be, in order to inculcate them in the schedule?
There is no problem in that. Look, there are 700 million mobile phones in this country. Smartphones are also number 500, 600 million. Similarly, everybody in the villages now, people are adept at using technology. Moreover, if you don't have a smartphone, then you can use some neighbor's smartphone and get yourself registered. You may have a feature phone, the message will come on the feature phone. So it's not necessary that you can register on your smartphone only. Right. So similarly, you can go to the common service centers or some other place where you can take the help of the other person to register, and you can give your mobile number, which will basically messages, etc. will come on your mobile number. So I feel that going forward, this will become a very easy and inclusive method of registration. However, if somebody is not able to register due to some reason, then he can come in as a walk-in person to any of the vaccination centers near him.
Okay.
So process is very, very inclusive.
Okay. Sir, one thing, the Gram Panchayats also have a significant role in it. Do you, in future, do you see the Gram Panchayats also getting into this? Somewhere in the village one can go and connect with the Gram Panchayat, and then one can go for the vaccination?
Absolutely, absolutely. Everybody will be needed in this great, it's a massive campaign. And there will have to be a massive awareness campaign at the Gram Panchayat level. And Gram Panchayat is the institution where you have the common service centers also. So Gram Panchayat, the public representatives can motivate and can, bring the people from the villages, those who are initially to begin with 60 years plus, or people with comorbidity whose age is more than 45 years. They can come and they can get themselves, they can mobilize them for vaccination.
Sir, one of the most important aspects of any task is the target that you set. Is there any target that you have right now, given the fact that in the initial process we saw slow pace of vaccination? What is the target that you are eyeing right now?
Well, I have really no idea about the targets, and I don't set the targets. I am the person who has been made responsible by the government to head that, vaccination software related backbone, which I am doing. Now, as I explained to you, this is a demand-driven process. People will come and after registration themselves, and I think that is the process which we will have to ensure that the process is smooth. With regard to how many people will be, inoculated or how many not, that's not really my area of expertise.
Okay, and with that, it's a wrap on this edition of the news. But remember, you can log into our website, mirrornownews.com, for more, or follow us on our social media handles on Twitter, Facebook, Instagram, and Telegram for more.